I'm Joey Pop. Welcome to HealthWise. If you've ever considered changing your smile, well, this show may be for you. We're about to explore the latest in cosmetic dentistry, from porcelain veneers to bleaching to color fillings. Joining us today, Dr. Ross Nash, a pioneer in the development of porcelain veneers, and his partner and colleague, Dr. Robert Lowe. Welcome, gentlemen, to HealthWise. This show is going to be fascinating. If anything, we have some dramatic before and after pictures of your work. But my first question, first to you, Dr. Nash, when you actually change somebody's smile, it goes beyond the look of a tooth or a set of teeth. That has to be a life-changing experience, true?
Joey, that's exactly right. As a matter of fact, one of the most rewarding parts of this type of work for people like me and my partner Bob is that the fact that the people that come to see us actually want to be there. You know, in conventional dentistry, where people were in pain or had disease, it wasn't a particularly pleasant thing, and the environment was not exactly positive even for the dentist. But today, when people want to look better and feel better, and that's the atmosphere in this country anyway, we're a part of that. And people actually choose to come to see us and are happy and excited about the changes we can make. And this happens to affect self-esteem. When people look better, they often feel better and act differently, and that's what's rewarding for us.
Dr. Lowe, your thoughts on that?
Well, I've exhibited the same experiences too, Joey. I mean, patients can typically come in and expect to be nervous or undergo problems and been to the dentist before, and it's a totally new situation today. The way that care is delivered, the techniques and the materials that are available to really benefit a patient's not only health but appearance makes it exciting for them, and we see the rewards of that every day, and it really makes practicing in our field much more rewarding experience.
Okay, gentlemen, let's jump right into it. We have some before and after pictures. Let's go to our first picture, and please describe to us exactly what we are looking at. Dr. Nash?
Well, this is just actually a simple case of bleaching before and after. A patient with less than white teeth would like to have a brighter smile, and there are a number of ways that we can do that today. You can simply make a tray to fit your teeth and use what we call a home bleaching approach, where the patient places a gel in their tray that we make them that fits quite well to their teeth, and over a period of weeks can possibly get a change, a lightening in the color of their teeth. Now, it's unpredictable, it doesn't always work, but it's very, very conservative and relatively inexpensive compared to the other options.
So this is done actually in your office. Can you also have it done over a gradual period of time?
Well, that's actually what I was talking about first. There's several ways that you can accomplish lightening of teeth through bleaching, and one of them is what we call home bleaching, where we let the patient actually do most of the work.
And that's the gradual process.
The gradual process over a period of weeks or even months sometimes. But there's another technique, and frankly, in our practice, we find at least half of our patients choose what we call power bleaching, and it's done in the office. It is a higher degree of chemical. It's something that you really couldn't use at home, so it's a more powerful chemical that's placed on the teeth. It's not detrimental, it's just more powerful. And the chemical is actually initiated or accelerated by a high-intensity light that is focused on it. And we can get about the same amount, or at least as good a bleaching treatment in 1 or 2 appointments in the office that someone can over 2, 3, or even 4 weeks at home. So there are 2 ways to do that.
Very good. Let's go to the next picture. I'm excited about these porcelain veneers. Is this as an example?
It's one example of what we call laminates, or changes to the surface of the tooth, whether it's just the front of the tooth or around the side. But people who have crowded or misshapen teeth can actually get them changed in 1 or 2 appointments. This would be in 2 appointments with an indirect laminate that is placed over that surface of that tooth.
So the tooth or the teeth in the lower right-hand corner, that is the veneer that we're looking at, as opposed to her upper left, and those are her real set of teeth.
On the upper left, you'll notice that the teeth are slightly crowded and rotated. Can you see that? You can also correct that with braces, but this particular lady is in her mid-40s and would very much like to do it immediately. And so with laminates, you'll notice in the lower picture there, the teeth look straight and a little bit lighter in color. And that's simply a new surface that's placed on the tooth.
Okay, Dr. Nass, I believe you have in the studio here a laminate. Do you not? Explain.
This actually I have a model here that has some teeth that have been prepared. The four front teeth have actually been prepared in the office. This is an actual case we're going to be placing, and you can hardly tell that they've been changed in shape. You do have to make a little room for the material.
So this is a real set of teeth.
That's right. And these are actually very small porcelain facings. And as you can see, I'll just rotate it over slightly, and you can see that it's a very thin piece of porcelain, and it actually fits on the very front part of these teeth, like this. I'm going to turn this model over so it won't fall down.
I think we get the idea there.
Yeah. Turn this over in this. So now the patient's tooth is upside down, but it'll stay on the table here. And we can actually open her mouth, or his mouth, with my little model there, and place this on the front of the tooth, and as you can see, it just sits right on the front of that tooth. And it's bonded there. It doesn't come off once it's bonded to the tooth.
How strong is that?
They're very strong. The lamination process of actually attaching the material to the tooth it makes the porcelain extremely strong. Porcelain in itself is a brittle material, but it's like a piece of kitchen tile, a floor tile. A strong man can break a piece of tile in his hands, but once that's laminated to the floor, it hardly ever breaks because it's supported. And there are tile floors in Europe that have been there 1,000 years. And it's the same type of thing. Once a ceramic material is laminated to an underlying strong structure like the tooth itself, it's extremely strong.
Dr. Lowe, when it's actually attached to the tooth, does that damage the existing tooth or does it make it stronger?
No, actually, it helps to make a tooth stronger, and we see that a lot when we're working on the back teeth and replacing older fillings. Traditional filling materials didn't bond to the tooth, Joey, so they actually just occupy the space and could actually, in larger circumstances, weaken the tooth. Whereas the bonded materials, by virtue of the adhesive nature of the cements, actually pull the tooth together and help make it strong.
I think we have another picture. Let's take a look at the next before and after. This is an example of your work. Now, tell me, this gentleman, this is the same mouth? He had a gap in the middle of his mouth there.
This is actually Dr. Lowe's case, and he placed laminates on those two central incisors. Bob, would you like to talk about that one?
Oh, sure. This particular patient had had braces at a younger age, and it's not uncommon that just because you have your teeth straightened doesn't always mean that you'll have all the spaces filled properly and everything will line up. Sometimes there's discrepancies in the size of the teeth that prohibit the orthodontist from closing all those spaces, and that was the problem with this patient. So we looked at tooth-colored veneers to correct that problem after the orthodontics had been done.
That's amazing that that is the same smile.
Yeah.
And what a difference of having a gap in the middle of your mouth as opposed to having perfectly straight teeth.
Yeah. And that was done in 2 appointments too, by the way, only 2 weeks apart. So conventional orthodontics, which would be another, he could go back into orthodontics and move those teeth together perhaps, but that may take a couple of years. And so we can make more immediate changes with laminate veneers.
Now, in some of these porcelain veneers, I've seen a color difference. Just in that example there, it looked like it was his natural look. But can I have my teeth whiter if I want more white than my natural color?
Oh, no question about it. One of the advantages to a lamination process rather than a bleaching process is unpredictable. You get what you get because it's nature working here. But with a veneering process, we can apply whatever color we like. And of course, it has to do with the environment that you place it in. If someone wants just 2 real white front teeth and the rest of the teeth are yellow, it doesn't look natural. But if someone is veneering all the teeth in their smile, a lot of people do that, you can make it any color you want.
That's fascinating. In fact, one of your colleagues has celebrity, Regis Philbin, right?
Yeah.
And he had his his teeth done, and when you see that show, you see Regis's big smile.
Yeah, big white teeth. Yeah, we know the dentist in New York, good friend of ours that did Regis's work, and Regis wanted real white teeth. They look great on TV.
They do.
Yeah.
They do look good. Do they look good in person?
Well, I've never seen Regis in person, but you know, people in this country, and it's beginning to be more around the world, but especially in the United States, people really want white teeth, even whiter than normal, and Regis is one of those people.
All right. Let's go to our first question from our viewers tonight. Since we cannot take your live phone calls, we do have some questions that have come in before tonight's broadcast. I believe it's a question from Weddington. Will bleaching last? And I believe that's something we touched on a little bit earlier. It's not, is it predictable?
Well, it's really not totally predictable. First of all, we're not sure what result we're going to get until it's done, but because it's such a conservative process, a lot of people are willing to give it a try. Should you get a result with bleaching, and most people get some type of result, we can expect a fairly long life out of it. However, it's probable that someone will have to re-bleach their teeth sometime in the future, and it's different for different people depending on what they place in their mouth. You know, wine, coffee, tea, tobacco, those things can darken teeth again. But they can also be bleached again. So I would, if someone bleached their teeth and got a good result, I would anticipate maybe re-bleaching every year to 2 years.
Here's a follow-up question from Carolyn from Mint Hill. She asked, is it true bleaching can make your teeth sensitive?
Well, the bleaching process itself sometimes can cause some sensitivity, and that's simply because of the chemical that's used, but it's a transient problem. However, we have treatments that we can use that decrease or eliminate sensitivity in most people. However, if you do get some sensitivity, it goes away.
We also have a question from Allison. What is bonding? How many appointments does it take? How long will it last? That's a new topic, bonding. Dr. Lowe?
Well, bonding in general terms is really using tooth-colored filling materials, Joey, to replace lost tooth structure that's either been lost from a previous decay or an old filling. And bonding describes the process of how we attach or affix these materials to the tooth. As for the length of time and how long these materials will last, they improve on almost on a monthly basis. I mean, there are new generations of materials.
Is this a picture of
coming
bonding?
out all the time. This is a picture of a lady that Dr. Nash repaired an anterior tooth that was discolored, possibly because of a root canal being done. That happens sometimes when teeth are traumatized, that one single tooth will get dark and the others won't. And one way to handle that type of problem is to veneer the surface. And one way to do that is using a bonding material. And it's a one-appointment procedure, which is different from what Dr. Nash was describing with porcelain laminates, which is a two-visit procedure where a laboratory constructs those restorations. With this type of restoration, it's done immediately in a one-visit type of scenario where we'll remove a little bit of the tooth structure to make room for the material, place it directly on the tooth, shape it, polish it, and the patient leaves.
Gentlemen, how does the porcelain veneers compare to crowns or caps? Is it basically the same type of technique that we're looking at that's just a little bit more advanced, or is it totally different?
Well, it's a very similar procedure to a crown or a cap in which the tooth is reshaped a bit, and then an impression or mold of that is taken, and in the laboratory of restoration that fits that model, as you saw here with these veneers, is made. A crown or a cap, though, goes all the way around the tooth, and conventional crowns with a metal foundation underneath the porcelain or a full gold crown required more tooth reduction, more drilling. The veneering process only requires reshaping, sometimes no tooth removal at all. And that's the same thing with the bonding process. Sometimes you don't have to take any tooth off at all. But oftentimes there's a small amount of reshaping that needs to be done to make room for the material. But it's much less than the conventional crowns. And you don't go all the way around the tooth necessarily. It can. But oftentimes it just covers the front or around to the side or over the edge, and only the part of the tooth that's damaged or needs change is covered, rather than the entire tooth being whittled down to to a nub like a conventional crown would be.
Okay, so that's a crown. How about a cap? How does it compare with
Crowns
a
and
cap?
caps, two words for the same thing.
Oh, okay.
Yeah.
Dr. Lowe, you have a model here. What is this?
This model, Joey, shows a couple of porcelain restorations that were made for a patient in our office in lieu of doing a full cap or a crown. The nice thing about tooth-colored materials is that we can bond them to the tooth. So that means that we don't have to always prepare the entire tooth for a crown. And getting back to what you're asking about the difference between veneers and crowns, a lot of times veneers are done on visible surfaces that you can see when you smile to affect a cosmetic change on a healthy tooth. Crowns are often done on teeth that have already had previous fillings or may have decay and have other problems that necessitate that more of the structure be removed prior to the restorative process. But this particular example shows two beautiful tooth-colored restorations that we can bond directly to the tooth and actually save a lot of the patient's healthy tooth structure by not having to do a total cap or crown.
Oh, I see.
The difference before is that we didn't have the availability to bond restorations to tooth. They were cemented, and that often necessitated that a lot of unnecessary healthy tooth structure be removed so that we could fix the patient's tooth. Now we do what the tooth needs. We literally remove the diseased part or the old filling, and we can have a little jigsaw puzzle piece of tooth-colored material made that is bonded directly into the tooth, makes it whole and strong again.
Okay, so I have a couple of crowns and I can eat comfortably. Can I eat comfortably with this in my mouth?
Absolutely.
And it's just as strong?
It's just as strong. As Dr. Nash said, they're laminated to the tooth and the same, bonded to the tooth the same way as the veneers. So they're actually probably stronger by virtue of the chemical means of attachment to tooth structure versus conventional caps or crowns that are cemented.
Gentlemen, how long have these procedures been in the marketplace?
Bonded dentistry, in other words, rather than cementing something on the tooth, actually attaching it to the tooth, has been going on in dentistry, for probably 30 years. But we've only, in the last 15 years or so, have we been able to bond to all tooth structures. In the past, we could only bond to enamel. So once the tooth has been prepared through the enamel, or that the patient has lost enamel on the tooth for some reason, the underlying structure called dentin was very difficult to attach to.
And we can do that now?
Now we can do it. We can bond to
Wow.
any structure on the tooth. So
And how long has that been in
about
existence?
15 years in that category, and it's getting better all the time. Each year we have a stronger and better bonding agent. So we're able to do things now that we couldn't even think about doing 15 years ago. And in another 10 years, we'll be able to do things we aren't even thinking about now. The technology is mushrooming.
Wow. Let's take another picture, shall we? Before and after of your work here in Charlotte. Now this looks very familiar in my mouth. Before, picture of fillings. And you mean to tell me that this is the same tooth with different fillings, with a different colored filling? What is that?
That's one of Dr. Lowe's cases.
And actually, this is one of our office staff, our patient coordinator, Greta. She presented like almost every patient presents in our office today. Many of us had silver fillings done 15, 20, 30 years ago because that was the only material that was available, one of the only materials that was available.
I can certainly relate.
And it was a good material at the time. But what we find today with the metal tooth fillings is that over time, because of temperature, the expansion and contraction of the metal in larger fillings can also cause cracking of the teeth and associated decay because they pull away from the margins. These are one of the major reasons why patients come in needing caps or crowns, because they break the part of the tooth that's left. So when we see a patient like Greta that has a silver filling that's been in function for a long time, is starting to show those signs, we intervene before the actual fracture happens, and we can, again, use a bonded tooth-colored material to replace the lost filling and literally hold that tooth together like a cast.
I'm
and that's what
glad
we did in the
that we've
after.
gone back to the picture. So let's make sure we perfectly understand what we're looking at. In the before picture, that middle tooth is the same picture down here on the after?
Correct.
That's the same tooth, it's just a different filling?
Right. The metal filling material was removed. You see on the before picture, there's little round pits or circles and a very dark looking reflection underneath the tooth. That's probably due to leaking and decay associated that is underneath. And you know, the one thing that's really interesting about that is this tooth doesn't hurt. People think that they wait until something hurts and then they need something fixed. And we really have the ability to really be proactive today and get in and intervene when we see something like that and fix it before the real problems start occurring.
Okay, so not only is it better to look at because you can't even tell there's a filling in that tooth, but you're also making the tooth stronger.
Absolutely, and that's what I tell patients when it comes to back teeth, because their initial comment is, well, it's in the back, I don't see it. They really have no sense on whether it's tooth colored or metallic. So I tell them, you know what, the tooth color, it's a secondary feature. The main benefit to you as a patient is that these materials can be bonded to the tooth and make the tooth stronger and allow me to take away less of your healthy tooth when I fix it.
Wow. And what I'm doing is taking the risk of having a crown down the road.
Absolutely. In the last 5 years in my practice, I know with Ross too, now that we're practicing together, the number of full crowns or caps that we do in the office has gone down appreciably because we can do these other types of procedures with bonded onlays and save healthy teeth and not just put caps on everything.
Okay, so if I go to my dentist, what am I asking for again? Just that's called the tooth color filling?
Well, the tooth colored filling is a broad name for the material. Bonded fillings are tooth colored. Porcelain or composite inlays or onlays are also tooth colored. So they're both used interchangeably. It just depends upon what the tooth needs.
Yeah.
The direct materials, the bonding materials, are used for smaller areas that need repair, smaller areas of decay. These restorations that I showed you here, these obviously were too large to put fillings in, and they needed something stronger. And the laboratory processed materials are stronger, and that's the main benefit of using those.
There are actually two ways to restore a tooth that has a hole in it, basically, an old cavity or an old filling that's been taken out. You can do it directly and do a filling, and that's what the tooth-colored fillings are. You can also use silver, which we used to use in the past, or you can do it indirectly. In other words, you take a mold of that prepared tooth and you make a model, as we showed you here with these models that we have. And the laboratory actually fabricates, and we use a dental laboratory for this. Not many dentists do this for themselves because the laboratories are experts on their own, as well as the dentists. And they actually fabricate these restorations on a model of the tooth, which will then fit the tooth. And the larger restorations we like to have done in the lab, because by subjecting these materials to things like pressure and temperature and heat and pressure and vacuum, things you can't do in the mouth, you can make them stronger. And so when they get larger, we like to do them indirectly.
I think we have another picture here of a direct filling. Is this correct?
That one's direct, and Dr. Lowe did the restorations on the lower right. He removed the silver fillings for this patient by the patient's request and replaced those with tooth-colored restorations. And as you can see, actually placed little grooves in there to duplicate the appearance of that first smaller tooth in the picture, which is not restored. That's a natural tooth. So he can actually mimic the appearance. Now, some patients don't want the dark stains back in there, but that's what natural teeth sometimes look like. So Dr. Lowe was able to totally recreate the look of a natural tooth in a single appointment on those two teeth.
You gentlemen are artists.
Yeah, well, Bob, make a comment about that, because he's particularly good at the artistic part of the direct fillings. Bob is known all over the country for that.
Wow, that's amazing.
What's amazing is that today dentistry actually, I think, is just as much art as it is science, and becoming more and more every day. And that by virtue of the tooth materials and what we can do as artists and the labs can do, we virtually can recreate or duplicate nature, and that it is very artistic. And that's what we train. We also have a dental practice, but we also teach, Dr. Nash and I, and have a training center. in our office, and we bring dentists in from all over the country, and we teach them these techniques to increase their skills and become more artistic and learn the new materials and techniques.
The teeth we just saw, how long will that last?
We're estimating that, and this is just from clinical experience, not scientifically, but I've been working with these materials for over 20 years myself, and so has Dr. Lowe. And from that clinical experience, I can assure patients that these products, direct fillings with tooth-colored materials, can be expected to last anywhere from 5 to 10 years minimum. I mean, nothing's permanent. Even the natural teeth wear out with time, but long-lasting. And the indirect restorations we're finding that are made in the laboratory, because we can subject them to other processes like heat and temperature, heat and pressure and vacuum, they tend to last a little bit longer. And we're estimating anywhere from 8 to 13 years. And then the ceramic materials, which are really the kind of the Cadillac or the Mercedes of all of this, in many cases, not in every case, but they actually have the longest lasting potential, we believe, especially in the front of the mouth, and probably 10 to 15 years. Now, those are just estimates, but very reasonable. The average cap, the original type of conventional restorations that we made in dentistry with a metal foundation and porcelain on the top, and that's what you see with most people now that have had them in the past, they last, according to the American Dental Association, 8.5 years or so, the average one. Some of them last longer, some of them last a lesser amount of time. And these newer restorations probably are going to do better than that.
Getting back to these porcelain veneers, once they're attached to my teeth, I go home, what foods can I eat immediately and what foods do I need to stay away from?
Actually, you can immediately begin to eat almost anything you want. Now, you shouldn't abuse even your natural teeth. I mean, hard candy and ice chewing, that's not even good for natural teeth. And you should stay away from those things, but you can eat corn on the cob and steaks.
I can bite into an apple?
You can bite into an apple and do all the normal chewing that any other, the natural tooth would do, or any other restorative material. That doesn't mean that things are perfect. I mean, there are fractures in restorative materials like we're using, as well as in natural teeth. So we don't really expect our restorative materials to be better than what God placed there in the first place, and they're not. But they're very, very close. And with the techniques we have and the materials we have today, patients can expect a long life out of well-placed and well-done restorations.
Gentlemen, you touched on that you are instructors of this, that you have dentists and other people come in from all over the country, around the world. I want to explore more of that here in the next half hour of this show. I find this discussion fascinating. I would assume that your patients are just awed by what you do, and once they realize that not only are you teaching perhaps a competitor, but you're also a pioneer in this.
Well, thank you. I am currently on the faculty at the Medical College of Georgia, just as an adjunct professor. My partner, Bob Lowe, was an associate professor at Loyola University for many years. And so we do have some background in teaching. Both of us love to teach, as well as we love doing the treatment. So because of that, we created this school. It's just a teaching center. It's not a college, but dentists today are very interested in acquiring the skills to do these things for patients. It hasn't been very long, really, that a lot of dentists have had that desire, because it's a whole new technology from what they learned in dental school. But what's happening to many of our dentists who come to our teaching center is that their patients are asking for these things. I mean, in the media, just like this, there is so much information that patients are learning about options that they didn't know they had. And so when they ask a dentist to do it for them, and he or she doesn't know how to do it, they lose a little confidence. And besides that, it is a fun way to practice. And many dentists are finding the rewards of providing desired treatment rather than just needed treatment for patients, not only financially. I mean, it's not all about money. I think any dentist can make a good living in any part of dentistry because it's a wonderful profession. But that's not what it's about. It's about doing what you enjoy doing and seeing people happy and seeing people smile. I mean, I have I tell other dentists I have never gotten a kiss or a hug for a good root canal, and I've done a couple of pretty good ones. But you do get that kind of reaction. I mean, somebody will improve their appearance, or you improve their appearance for them through the cosmetic dentistry, and they'll give you a hug or a kiss or give you a bottle of wine or bring you flowers.
The most popular guy in town.
Yeah, I had a lady go to my daughter's wedding because she just appreciated so much of what we did, and it makes a big difference in their lives,
Sure
and that's what fills us up inside.
Wow, great discussion tonight. You're enjoying HealthWise here on WTVI.
An educational grant for HealthWise is made possible by Philips Oral Healthcare, makers of the Sonicare toothbrush, patented technology designed to promote whiter and healthier teeth. If you would like support group information about tonight's topic or any other HealthWise topic, you may call SupportWorks at 331-9500. For more information about tonight's guests or upcoming HealthWise shows, please call the HealthWise information line at 371-8836.
For questions or comments, write to HealthWise, WTVI 42, 3242 Commonwealth Avenue, Charlotte, North Carolina, 28205, or email us at healthwise@wtvi.pbs.org.
Welcome back to HealthWise. I'm Joey Pop. Fascinating discussion and before and after pictures, show and tell here tonight on HealthWise as we explore cosmetic dentistry. With us is Dr. Ross Nash of Charlotte as well as Dr. Robert Lowe. Once again, gentlemen, thank you so much. We were talking about that the fact you are instructors, you're pioneers in this subject, and you, Ross, you were just in South America, were you not, with this?
My wife and I went to Lima, Peru to lecture to one of the local groups of the Academy of Cosmetic Dentistry down there, and really enjoyed that. They're surprisingly up to date with their treatment and very interested in what we're doing in the United States in the area of aesthetic dentistry.
Very good. Now, something that I do want to touch on, and we've heard of implants for several years. Implants, is that still taking place, and how does that work into what we're looking at here tonight?
Well, Dr. Lowe does most of the implant reconstruction in our office, and he's extremely good at it. Bob, I'm going to refer to you on that.
It's actually a procedure, Joey, that's, I think,
we do have a picture, I believe,
being more and more utilized as options for treatment in patients today. Like bonded dentistry and other topics, this area of implant dentistry has been evolving over the last several years to a point where it's extremely predictable. One of the advantages of a patient like we see here, the before after, this particular patient had lost one of her front teeth. Conventional means of restoring that before implant dentistry would mean having to completely prepare or the teeth on each side to suspend a false tooth in between, which would mean a cap on each of the other teeth.
and is that called a bridge?
That's called a bridge. That's exactly right. And now today we have the option, and you see this lady has two perfectly healthy teeth on each side of that particular site. One of the other things that implants do for patients, it's an extreme benefit, is that it holds the bone. An implant is basically an artificial root. And the thing that holds the bone and the gums in place, you've heard the term long in the tooth, and as patients age, sometimes their teeth look longer and their gums recede. That's because the bone is lost. And when a tooth is removed, that process is accelerated. So the implant actually acts as an artificial root and holds the bone in place, and we can end up with a much more aesthetically pleasing result over a long term, a long period of years, possibly than in the same situation when using a bridge.
Now let's go back to that picture. Dr. Lowe, is that a post that we're seeing exposed in the upper left-hand corner picture, and then the picture below, that the tooth just goes up into the post?
What you're seeing, Joey, on the top picture on the left is what we call a healing cap. When an implant is placed by the surgeon and the periodontal specialist places the implant for us, he screws a little healing cap to the abutment or into the implant. The implant itself is actually slightly below the gum tissue. because we want to develop the tooth coming out of the gum like it does in real life. So when that little screw that you see on the upper left or healing abutment is removed, it exposes the top of the implant, which is below the gum. We then have something we called an abutment or a post that screws into that implant that creates what we would have if we prepared a tooth for a cap or a crown. In other words, it mimics the size of the tooth underneath the prospective cap or restoration. We then make a crown just like we do in the laboratory for a natural tooth. And we cement that or screw that onto that post or abutment.
Okay.
And that's what you see in the lower right. You see the tooth restored on the implant, virtually undetectable from the fact that the tooth, the central, we call a central incisor, the front tooth on the left that was restored with the implant. The tooth on the right, the patient elected to have a porcelain veneer on that tooth because, as you notice on the upper tooth, that her natural tooth was a little misshapen at the bottom, and we wanted to get a nice aesthetic match. So we put a porcelain veneer on her natural tooth.
I see. So that goes up into the bone, the black part that we're seeing here.
That black part or cap, right, it's a healing cap that has a screw portion that screws up into the implant, which is located in the bone.
Fascinating. Does insurance pay for these procedures, Dr. Nash?
Well, insurance certainly covers the needed type of dentistry at some level. In dental insurance.
Dental insurance, we're speaking.
Yeah, dental insurance is not a tremendous benefit to people. It's hard for them to understand that, but it's only intended for fairly minor things. However, there can be some help from insurance companies. Patients really have to be willing to make the investment, though, in aesthetic and cosmetic dentistry.
Okay, very good. Let's go to another question from our viewers out there across the Piedmont. I believe we have one from, is it Jennifer from Gastonia? Jennifer asks, please compare bonding and porcelain veneers. We've been talking about both here tonight. What is the difference?
Well, as Bob said earlier, bonding is a process, is used for a process where you actually restore the material of the tooth at a one appointment technique, where you place the material on the tooth, sculpt it, shape it, make it look like a tooth. That's what's considered bonding. You actually bond a porcelain veneer on also. When the word bonding is used, it really refers to a material called composite resin. And composite resin is made up of glass particles in a plastic matrix, so it's glass and plastic. And it starts out as kind of a putty-like material, and you can chemically treat the tooth so that it adheres to it very well, and then shape the material and layer it and add different colors and become an artist right on the tooth. That's what the dentist does with what's called bonding. And it is probably it would cost a little bit less than a laboratory procedure because there's not the expense of having it made in the laboratory and only one appointment. And it can be a little more conservative. You don't have to take quite as much of the tooth away to do this. And there's a lot of things that can be done. Fillings in the front can be done. Parts of tooth that are missing can be added. Replacement of silver fillings in the back or new fillings from decayed teeth with tooth color. Those can be done directly. A veneer on the other, well, these can actually be called veneers also. Direct composites can be placed on the front of the tooth, and a veneer simply covers the surface of something, just like this table is probably veneered. But an indirect veneer, and that's what porcelain is, the difference is that, again, that's made in a dental laboratory. It's made with a harder material that's more stain resistant, more durable, and then it is actually attached to the tooth through this same process of bonding with this composite material as a thin liner between the tooth and the porcelain, and this lamination process makes them one.
Okay. You know, one of the more dramatic before and after pictures you've brought for us tonight, you show how someone has worn down teeth and you can actually bring their teeth back. I believe we have a picture of that, and let's see if we can get it up and running here. That has to be a life-changing experience.
Yes.
There's a good example. Here this person has a completely different look now.
Yeah, the teeth in the upper left corner were worn and rotated, and they weren't always that way. When she was younger, they were perfectly normal, but over the period of years, she's had some wear and breakage and types of things happen there. So In the right-hand corner, you see those teeth have been laminated with porcelain. And we've added the edges back, we've actually lightened the teeth a little bit, we've closed the spaces, and she really has the look perhaps she had when she was more youthful. And it's a brand new smile for her.
Now that's pretty white.
Yes, she chose a white color, and if you'll notice, it's a little hard to see there, but the veneers go all the way back to the corner of her smile.
So you've actually broadened the smile?
About 10 teeth, you see. So that way she can make it any color she wants. Had she only done veneers on the 4 front teeth, then we'd want to be sure and match the back teeth so that they don't look like they're out of place.
Not only have you given her a different look, but you've actually broadened her smile.
Yes, you can do that too. And sometimes people would like to have a broader smile. In other words, the back teeth are tipped in a little bit and it looks dark behind the 6 front teeth. And we actually can widen the buccal corridor, it's called, and give people a little wider smile. And that's an inviting thing for a lot of people today.
Dr. Lowe, I'm going to bring you in on this conversation.
Okay.
We have a before and after picture of you. You not only are the dentist and the instructor, but you're also a patient. Will you please describe this process here and what it was like for you before and after?
Well, I tell you, Joey, I was pretty much like the average patient on the left side who thought that my teeth were okay, and even coming from a background of knowledge that I know, there were certain things that I just was not real pleased with. But like the shoemaker whose kids are the last to get new shoes, a lot of times the professional is the last one to be taken care of because we're busy taking care of everybody else. But I really made it a point because I wanted to be able to communicate to patients, and this is something we tell our dentists that we train too. We really believe in having these types of things done, and I think what conveys it to the patient is when they see that we believe in it enough to have it done ourselves. And it's not just a cosmetic change. My teeth were slightly crooked. Just like everybody over the time, your teeth wear down. See, the front teeth were designed so that when you chew, your back teeth don't rub together. That's what causes them to wear away quicker. The front teeth actually protect or guide the movement of the jaw. And over the period of years, I'd lost that guidance. My front teeth were worn down, and now my back teeth were wearing at an accelerated rate because they were touching in those types of chewing movements where they weren't designed to. So
where they were not doing that before.
Right. And that's very similar to the patient that Dr. Nash just described. When the front teeth are worn down, it's not only because they don't look nice, but it starts the whole system going into a rapid failure mode because the back teeth are designed to touch only in up and down movements, not side to side.
Now, as a result, am I feeling this in my jaw? And am I altering the shape of my face?
Well, as time goes on, usually these changes are so gradual that we have a tremendous capacity to adapt, and only in real small percentage of patients do they actually develop what patients know as TMJ or muscle problems, but they certainly are possible when the teeth are worn down. So I needed to not only seek a cosmetic change, but I needed a functional change as well. And that's something that's important for patients to understand. It's not just making the teeth look pretty. You know, one of my teachers in school always said, you know, if the teeth work well, if they function well, they look good. And if they look good, they function well. We really can't separate those two things. And the fun thing about cosmetic dentistry is, you know what, we're restoring the system too. We're making it look great, and we're making it work longer and better. And my front teeth were lengthened a little bit so that my back teeth would separate because of the opportunity of my teeth being slightly crooked and veneers being done.
Not only
my
that.
teeth are now straighter.
Not only that, but I can see your bottom teeth now.
Yeah.
Right.
Talk about that.
Well, as the teeth wear down, your bite can collapse. In other words, your lower jaw closes farther up into the upper jaw. And we see that with patients as they get older. They get lines around the crack of their mouth, around the corners of their mouth. We see that with patients that wear dentures or false teeth, where the bone is lost because the roots are gone. Back to that implant topic about holding the bone. And their lower face really collapses. So we have the ability to correct those problems as well. When we see patients with worn dentition or missing teeth where their face is collapsing or the lower jaw is closing too far into their upper jaw, we can restore the relationship, and that creates that youthful appearance again and recreates a situation where patients look younger, feel better. I smile more. I can tell my patients with confidence that, you know what, a typical thing that happens is a patient will say, you know, I just had that tooth fixed and it's a little sensitive. How long is that going to last? I said, well, you know, I had some deep fillings in some of my teeth, and they were a little sensitive for a few months, but you know what? A little bit of patience and they'll get better. And I think the patients can really feel that since you've had it done, it's more like you're telling it from your own experience rather than just, you know, telling them, giving them an excuse.
Right. Give us a big smile. All right, look at that.
Yeah,
now, because I was going to say, if you go back to the before picture, you have a nice looking smile on that before picture. So from what I've just heard you say, it goes well beyond trying to do something and the vainness isn't there. It's really for the health of the mouth.
Absolutely, absolutely.
Yeah.
You know, and health is first and foremost. But you know what? If you're going to have the teeth fixed and be healthier, why not look better at the same time? And that's one of the reasons why I chose to have whiter teeth.
As a matter of fact, Bob's wife, Michelle, calls him Lance Hollywood now because when we did his porcelain veneers, he chose Hollywood white.
Well, okay, now I'm sitting here live looking at you, and it doesn't look unnatural. That looks very natural.
Yeah.
So that's the whitest white. Give me another smile.
Yeah.
That looks very natural.
Well, see, the thing is, Joey, that, you know, the Hollywood appearance with veneers are so thin that some of the color comes from the tooth underneath. And the tooth is not the same color by the gum as it is by the biting edge. There's a slow transition of color. And when a tooth is veneered, because the veneers are very thin, some of that color is allowed to come through. So although the tooth appears much lighter in appearance, it still has that gradient of color from the gum line to the edge, which gives it the natural appearance. It's not like toilet bowl white from top to bottom, which is something that would be objectionable, I think, by most people.
Well, I would add, though, to that, and Dr. Lowe knows this too, that patients really want teeth that are whiter than normal today. I mean, the Hollywood white color that I would say 50% of my patients ask for today when they're doing as many veneers as we did for Dr. Lowe. And he has 10 uppers and 10 lowers. You can pretty much choose your color, and 50% of my patients on average are choosing the white color.
And the other 50% wish they had after they had.
Yeah, some of them
Really?
But you can make these porcelains look any shade you want, and my teeth have been veneered also, and I chose a shade that's not quite as white as Dr. Lowe's, but it still looks white to me.
Okay, so if I come into your office or I go into any dentist's office who does this procedure, are they going to show me what this is going to look like before I decide to do it? And how close is that look compared to the final result?
Oh, certainly. We have computer imaging we can do. Often we can show a patient very similar what they're going to look very, very close. Now, it's a simulation, it's a computer simulation. We can usually do better, frankly, than the computer can. But we can give them a good idea with computer imaging. Also, we can actually make little models of their teeth and change those teeth on the model with wax or composite materials and give them an idea about what they're going to look like when they get done.
The other thing, too, is many of our staff has also had their teeth treated. And we have different colors in the office. So if Dr. Nash is doing a consultation on a patient, he may call me over and say, Bob, come on over here. I want to show you. I want this patient to see what Hollywood white looks like on a man. Or his office or his dental assistant, Shannon. She has Hollywood white. And we have people that are A1. Dr. Nash is A1. We have people that are B1. These are just different shades. And it's tremendous that they can come in and smile for the patient, and the patient can see what these different colors look like.
Wow. Is there a point of going back if I'm not pleased with the porcelain veneers? Is there another option for me? Can I go to a crown then, or to an implant?
Absolutely. Certainly they're not removable. So it's not as if once you accept the veneers and get them bonded to the teeth that you can't just take them off. But
unlike a cap then.
It's unlike a cap, which can be sometimes easily removed because it's just cemented in place. However, I really can't remember a patient that has wanted them removed once they're happy with the way they look. However, later on down the line in life, perhaps the tooth needs more treatment, and that can happen. You still can cap the tooth. So it's not the end of the road once you get a veneer. It's probably just the beginning of a lifetime of beautiful smiles.
Is it going to protect me from getting a cavity? Is there some type of protection?
The best protection
with this?
against getting a cavity is the toothbrush. You know, we're sponsored by Sonicare for this program, and one of the things that we use in our teaching center is, and educating our patients is proper home care and maintenance is so important, just like anything. There isn't anything magic that we can put in a patient's mouth that the patient can expect a long lifetime without doing their end, doing their homework, and providing their maintenance. So while the materials themselves won't decay, the tooth around those materials certainly can, just like they did before they were restored. So it's important for us to follow up and for patients to be educated on proper maintenance. And when that's done, these materials and procedures, I think, can far outlast these expectations that the ADA prescribes. I mean, it really has to do with good communication, both with the doctor and the patient. And as I tell patients, we stack the deck in your favor. We give you everything that we know as far as technology and experience. And if you do your homework, if you come back for your regular visits, and we are allowed to maintain and watch these restorations over a period of years, I see patients that Dr. Nash had bonded 15 years ago with materials that are in no way as good as the ones we have today, and they look gorgeous. So the potential, when people ask for longevity, we have to give them an idea, because nothing lasts forever. But I think the potential is extremely good, that we can expect a good long service for these procedures for patients.
Gentlemen,
excuse me.
I was just going to, following up with that, I guess my point or my question is, as a result of having what looks to be protection, if I'm having something put over my tooth, does it actually prevent me from, whether it's gum disease or tooth decay down the road? Or on the flip side of that, if I don't watch it, if I don't floss like I should, could it promote such?
Well, I don't think it's a matter of the material or the restoration causing or helping either. You certainly eliminate disease. If we've got decay in your tooth, you can take it out and replace it with one of these wonderful restorations. But just as Dr. Lowe said, the secret to not having continuing disease is maintenance, is to continue to have good oral health. So I wouldn't say that the restorations are protecting the teeth. They're certainly replacing something that was bad before with something that is good now, but it's the maintenance that's important. For instance, I use a Sonicare every day myself, and we give our patients, when I get through with a
complimentary
porcelain veneer case, we give our patients a Sonicare toothbrush, because it is probably the most effective cleaning device we've found.
I would think if someone's going to invest in having this done in their mouth, that they will take extra care in making sure that they keep good dental hygiene.
I can tell you from my own experience, since I've had my teeth restored, I've flossed a lot more, I rubber tip a lot more, and I'm the health professional. I mean, it's easy in a busy day to not do these things, but when you take the time and make the investment, and you feel better, you want to maintain that, and I think it's just human nature.
I guess you take that extra pride.
Absolutely.
Yeah.
Especially if you're gonna make that commitment and that investment for yourself. How far away do your patients come? Is it Charlotte? We know your instructors and your other dentists come from all over the place.
We get patients from the majority of our patients are from this area, because we're a local practice. Dr. Lowe takes care of most of the general dentistry in our practice, and he does cosmetics and reconstruction. I do mostly aesthetic and cosmetic treatment myself. And the vast majority of our patients are from this area. However, I treat some dentists from around the country. When I lecture on the road and they see what can be done, even dentists like to have things done, and they kind of like our conservative approach. So we get dentists fly in to be treated. So does Dr. Lowe, because he lectures nationally too. And we have had patients, it's not unusual to have a patient fly in from New York or up from Florida or other states, because they've heard of us and they've heard of our quality.
Sure. As far as your doctors coming in from all over, how often do you see those instructors? Is it daily? Is it every 2 weeks in order to keep your practice going?
Our teaching center?
Yeah.
We have 25 programs scheduled in 2002 in our facility. They're all on weekends. I see patients about 3 days a week. Dr. Lowe works full-time, which is about 4.5 days a week. But we have a passion for what we do, and we don't stop with doing it. We enjoy teaching it. So both our teaching center and our practice is going full-time.
Full-time commitment.
I think we have time for one more picture, if we can see a before and after very quickly. What's an example of this? I see a lot of gum there.
Well, this is a gummy smile. That patient was referred unusually to Dr. Lowe in Chicago before he moved, and to me after he moved here. So we treated her together, and Dr. Lowe actually raised the gum tissue on that lady.
Wow.
A surgical procedure.
And then I veneered the upper teeth.
Well, gentlemen, it has been a pleasure, and this whole hour's just flown by. It's been a fascinating conversation. Cosmetic dentistry continues to flourish. Thank you, Dr. Nash, Dr. Lowe. Join us next time on HealthWise. I'm Joey Pop. We hope this show has helped you become more HealthWise.
If you would like support group information about tonight's topic or any other HealthWise topic, you may call SupportWorks at 331-9500. For more information about tonight's guests or upcoming HealthWise shows, please call the HealthWise information line at 371-8836. Views expressed on HealthWise are those of the participants. Stay tuned for the Antiques Roadshow, coming up next on WTVI. An educational grant for HealthWise is made possible by Philips Oral Healthcare, makers of the Sonicare toothbrush, patented technology designed to promote whiter and healthier teeth.